what do you do if your baby was just born and there seems to be some problem with the baby, some issue neurologically, physically, something that must have happened during the course of labor? And now, what do you do as a parent? Well, first thing that you try to do is talk to the physicians taking care of your baby and try to get an understanding in lay terms as to what's going on. Does the baby have a injury to the brain? Did the baby have any hypoxic injury or decreased oxygen to the brain during the labor or during the delivery? Was there any trauma that the baby sustained at the time of delivery? How's the baby doing right at that moment? What scanning, ultrasound, or imaging study are they planning to do to try to evaluate the potential injury to the baby? And how's the baby's current oxygen levels doing right now? Another issue to talk to the providers about is whether or not cooling of the baby's head needs to be done, because cooling of the baby's head sometimes can help decrease the effect of a brain injury. Your concern first needs to be about getting good care for your baby and trying to limit whatever damage occurred during the child birthing process. Once you kind of get that figured out, then you need to request the medical records, and you should have them reviewed fairly promptly by someone knowledgeable so that they can tell you whether or not there was some issue with the care that was rendered. That's important because medical records over time sometimes get more difficult to interpret. It's always better to look at something pretty soon after it's happened. People's memories are better. You can get better information. And not everything that happens in the birthing event is necessarily recorded in the medical record. Especially today with electronic medical records, sometimes things are not put in the record that should be put in the record. So it's important, if you think there's actually been an injury to your baby, that once you feel like you've assessed the injury and talked to the providers and the baby's getting the care it needs to try to minimize the damage, it's important to get the records and get them looked at and find out whether or not there's an issue with the care. If we can be of help in that regard, please feel free to click on the link below, and we'll be glad to help you in assessing your case.